Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the upper anterior zone. There is an edentular space in the upper right central and lateral incisor. The patient apparently has a RPD, which we can see on the CBCT here. There is a crown cutting done in the upper lateral incisor, and the canines and the other anterior teeth seem to have class 5 cavities present. Moving to the panoramic view, on the panoramic view, we can clearly see that this is the edentulous area. We are going to measure the ridge width and ridge height for our kind doctor. Now, in the lateral incisor region, from the transaxial view, we can see we've got very good bone, 7 millimeters of bone width with approximately 19 millimeters of bone height. We've got D3 level of bone, but we've got very good cancerous bone that can take an implant very comfortably. Moving to the central incisor region, the bone slightly creates a defect on the buccal aspect, but here we can see that we again have adequate bone in the buccal region. If we go slightly below the crest, we've got 7 millimeters of bone width with approximately 16 millimeters of bone height. We will show you the nasopalatine foramen, and there we go. That's the nasopalatine foramen. That's that right there. This is the central incisor on the upper left hand side. It does not show any periapical pathology. There's single canal. Moving to the lateral incisor on the upper left hand quadrant, we can see that there's been crown cutting done. We see a periapical radiolucency, a hypodense area. We also see a little bit of a resorption on the palatal aspect, and we can only see a single canal here present right at the tip starting right here. So this tooth probably is non-vital. Moving to the canine, here we can see a very classical class 5 lesion. There is no periapical pathology as such associated, just a little bit of a widening of the PDL, but we don't see a pathology in this region. I will show you the axial view of the upper jaw as well. So this is the upper left side, this is the upper right side. This is the upper right side and this is the upper left side. As we move slightly down, we can see that the architecture becomes a little evident. We've got a punched out appearance here, but we can also see that this area can support good healthy bone and can support an implant very comfortably if placed in the center of the ridge. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.